Everyone, and welcome to today's webinar, Accessing Benefits for Brain Injury Survivors. My name is Rachel Ishak, and I'm a community outreach specialist at the Brain Injury Alliance of New Jersey. And the Alliance is a nonprofit organization with a mission to provide education, awareness, prevention, strategies, advocacy, and support for those who have been affected by brain injury. So I just wanted to announce that we have some upcoming events. We have a professional seminar coming up in May, but by way of webinars, we have one on November 15th on work readiness for brain injury survivors. And then we have one on December 14th about transportation resources for brain injury survivors. So you can find more information on our website, and hopefully you can join us for those as well. Just a few housekeeping notes before we begin. Your microphones have been muted, so if you have any questions during today's webinar, please put them in the Q&A box, and we will get to as many questions as we can at the end of the presentation. And the webinar is being recorded and will be available for viewing on the BIANJ website after this. At the end of the webinar, you will get a link for a post-webinar survey through the chat. We value your feedback, so you are encouraged to complete the survey, and you must complete the survey in order to receive a certificate of attendance if you're looking for that. And so now I just want to introduce our presenter for today. Her name is Cindy Clark. Cindy founded the Tri-State Advocacy Project after her father died from a C1, C2 spinal cord injury in 2002. Before starting this organization, Cindy was a volunteer with the Phoenix Society for Burn Survivors and served as the organization's vice president for several years. Cindy's interest in this work evolved from the knowledge that navigating the system of healthcare benefits is too complex and can be very overwhelming for patients and their families who are facing a serious illness or injury. The Tri-State Advocacy Project helps patients identify and obtain health insurance and government benefits, and assists families in obtaining needed services and supports to help patients to continue living safely in their homes. And they also share information on other community resources. All of these services are provided by the Tri-State Advocacy Program, and they are free of charge. And so now I am pleased to welcome our presenter, Cindy Clark. Cindy, you can take it away.
Well, thanks everybody for joining us. I think this is an extremely important topic for anyone who has a member of a family with a brain injury, is a brain injury survivor, or works with people who has a brain injury. One of the things that I usually start with for helping people understand what benefits are available is private health insurance. So private health insurance has several things that we always look out for. First of all, I always try to get a copy of what's called the certificate of coverage. And under the certificate of coverage, it'll tell us all of the provisions of the policy. Deductibles, what your out-of-pocket maximum is, policy limitations, which are extremely important. Especially now, because one of the first things we'll see under limitations is you only have 30, 40, 50, 60 outpatient visits available. And why that is so important is because most people need a lot more benefits than that. And that automatically raises a red flag for me when I'm thinking about what the person is going to be going through as far as the rehabilitation. The other things that I look for are policy exclusions. And policy exclusions are mainly there is no nursing, there is no private duty nursing benefits. This policy does not cover personal care services. That is considered custodial. And these also, again, are very important benefits for anyone who's ever suffered a brain injury. And then finally, the appeal procedure. After the Affordable Care Act was enacted, we have a new appeal procedure. And one of the important parts of that is the external appeal process. So the typical insurance appeal will initially be a peer-to-peer review, your doctor with a doctor from the insurance company, the family first level of appeal, which is something that I like to help families with, and that is identifying all of the contractual benefits that are available and what is considered medically necessary for a particular benefit. And then if we lose on that level, we do have an external appeal process. Under external appeal process, we can tell that it'll be much more likely to be approved because this is out of the insurance company's hand. They no one has a fiduciary interest in either either approving the benefit or denying the benefit. So those are the important parts about the private insurance benefits. One thing that I want to say is COBRA coverage. Most people will be offered COBRA coverage depending on how long their employer is willing to cover their benefits. If anyone loses their health or becomes unable to continue their payment of their health insurance premiums, I advise them to please call us, because the one thing we do not want them to do is lose their private insurance in the midst of their rehabilitation process. That can affect what durable medical equipment is available. It can affect whether they can go to a skilled nursing facility, how long their rehab is. So if you've been notified by your employer that your benefits are terminating on such and such a date, and you have to accept COBRA, which is when you pay for the premium, then that's when we really need to get involved. Under COBRA for a disability, someone can stay on COBRA for up to 36 months. Usually that's not really necessary because once you go on Social Security disability, after 24 months, you will be eligible for Medicare. Okay, so let's go to the next part. I'm going to move along pretty quickly here. New Jersey Medicaid. That's one of the other things that I think is very important for us to identify for people who are eligible. Unlike what many people hear, you can have private insurance and Medicaid at the same time. Private insurance will remain primary and your Medicaid is a secondary coverage. Under the Affordable Care Act, also certain things have changed, making more people eligible for New Jersey Medicaid. The first part is the income. The income limit is now much higher than the regular poverty level income. The second thing for family care is your assets are not considered. So the only thing that someone will be looking at is your income. Private duty nursing and personal care services are not covered under straight Medicaid in New Jersey. We do have to pick up the expanded Medicaid to be sure that we have those services. And everyone has to choose a Medicaid managed care plan. When we choose a Medicaid managed care plan, I like to be sure that we are enrolling in one that everyone has access to doctors and hospitals that they want to see. So that usually means looking through the provider list and being sure that if you want to be seen at Kessler, Cooper Hospital, wherever you want to go, we want to be sure that it is in that managed care. When someone is injured and is uninsured, hospitals can do something called presumptive eligibility, and that will give them Medicaid right away. The other advantage of Medicaid is what they call a 90-day look-back period. So if you enroll in Medicaid as of November the 1st, any of your hospital bills for October, September, and August will be paid if we submit them to Medicaid, because that is the 90-day look-back period. And that's important too, because if you had your private insurance, you may have a $10,000 deductible. So we want to be sure that those bills that weren't paid because of your deductible are being sent to Medicaid for coverage. Very few people can afford huge amounts of medical bills, and it's important to look at every possible option to get those bills paid. Okay. So let's talk about New Jersey Age Blind and Disabled. That is New Jersey's expanded Medicaid coverage. And that is the one that covers personal care services, private duty nursing. It also has a $5,000 allotment for home modifications. Assistive technology is covered. The test for being eligible for New Jersey Age Blind and Disabled is you have to meet the clinical requirements. And that means that you need assistance with 3 or more activities of daily living. One of the things that I found out from working with clients with brain injuries is because most clients who apply may not fit into the typical eligibility requiring assistance. So they may be able to walk, they may be able to talk, but one, if you can't drive, that's assistance that you need with activities of daily living. If you have cognitive impairments and can't remember to turn off the stove, that also is requiring assistance for activities of daily living. Reminders for medications, unable to handle multitasking. There are a lot more things involved than just walking, dressing, preparing meals. And sometimes people are denied the benefits because the person who's doing the assessment is only looking at those things. If someone is denied because they say, well, you can dress yourself, you can walk, you can take your own shower, but we're denying you those benefits, we have to appeal those. The people that do the clinical assessments for the state are not always up to date on all of the requirements. And requirements for activities of daily living go far beyond dressing, bathing, and preparing meals. For managed long-term services and supports, only the income of the individual that needs the services is taken into consideration. If your spouse is working, that is not taken into consideration. If someone is over the income limit for the managed long-term services and supports, we can take the additional money that is over that income limit and put it into a qualified income trust. And that way it brings down what their income is, and it does allow them to get the program, to qualify for the program. The other thing that is important when applying for New Jersey Age Blind and Disabled is financial eligibility in regard to resources. They do not consider your home, your vehicle, things like that as a resource. They're mainly looking at money that you have in the bank, CDs, retirement accounts. If someone is applying for this program, they will look at a retirement account, an IRA, for the individual who is applying, but they will not look at that for the spouse. However, any joint checking, savings, other types of assets that you may have will be considered. A lot of times when someone's assets greatly exceed the amount that's allowed, we have to consider putting money into a special needs trust, or if it's a person under the age of 26, we can deposit money into what are called ABLE accounts. And ABLE accounts do not count against the individual for either Medicaid or for SSI benefits. So and every state has one. You're able to put $15,000 a year into an ABLE account. You do have access to that money. It's just that it is protected from both the Medicaid eligibility for resources and also SSI. Other things that we always like to take into consideration are other programs that are out there. And of course, the first one that comes up is the Traumatic Brain Injury Fund, which I won't go into much because everybody else who's on this conversation can most likely do a better explanation than I can do. New Jersey Workability is a great program for anyone who has income or assets that are above the typical limit for either Medicaid or for the managed long-term services and supports. Under the Workability, you are only required to work a few days a month. You don't have to work a full-time job, a part-time job. The income level is, I believe, about 300% of the federal poverty level, which probably brings it up to about $3,200 a month. The asset level is very high. They do not look at what you have in an IRA or a 401k. So that often makes people eligible for medical assistance who typically would not be eligible. New Jersey also has a program that is unique to the state, and it's called PASP, Personal Assistance Service Plan. Under this program, which is not a Medicaid program, so you do not have to go through financial eligibility testing, you can get personal care services if you are working, going to school, or volunteering in the community. This is a great program, and a lot more people are able to get needed personal care services that typically may not be able to, especially if you're working and your income or your assets are way above the New Jersey Workability. You'll still be able to take advantage of getting this help in the home. Another program that is unique to New Jersey is their temporary disability. One of the biggest challenges that most people face after a serious traumatic brain injury are the 6 months that it's going to take for them to get Social Security disability. And that's if they get approved immediately. However, New Jersey requires employers to contribute to a temporary disability fund, and this provides disability benefits during that gap period before Social Security disability will actually begin. It's a 3-part application. The first part is for the individual information. The second part, your doctor would fill out, and the third part is for your employer. New Jersey does do the approvals pretty quickly. So I recommend anybody who is needing to get that money started, definitely get it started. Even if the individual is still in the acute care hospital, we can still apply for those benefits. New Jersey also has a catastrophic illness in children relief fund. And this goes up for children up to the age of 21 who have extraordinary medical expenses. This is based on income of the parents. So it would be for any medical bills, I believe, that exceed $100,000 that can be paid through this catastrophic illness fund. All right, so let's talk about Social Security, because I think that's one of the things that really people struggle with. There are 2 types of Social Security disability benefits. SSI, which is Social Security income for anyone who does not have an extensive work history. So that could be for a child, a young adult, adults who did not work. What we're running to is a lot of adults who worked but didn't pay into the Social Security system and were paid under the table. That always sounds like a great idea, but in reality, that is not, because you're really limiting what your benefits are going to be if you become disabled. For the Social Security disability income, you have to work a certain number of quarters depending upon your age. And we usually check that, or we usually have our clients check it by going to their own mysocialsecurity.account.gov. And when you log into this, you'll be able to see, it will say, if you become disabled today, you will receive X number of dollars in disability benefits. If you have minor children, they will also receive disability benefits. So that's the easiest way to determine. Social Security does not allow us to do SSI applications. They handle them directly. However, what we do for SSI recipients is we do go through the application process with them verbally. And we make sure that they understand what Social Security is looking for, that they have the functional need that will limit them, that they cannot work. And the test is that your condition is so severe that you will not be able to work for at least 1 year. Social Security has what they call a list of impairments. And what we have to do is we have to take anyone's disabling condition and compare it to Social Security's list of impairments. The odd part about doing that is you often have to look beyond just the category of the impairment. Traumatic brain injury will fall under a neurological category. However, it also affects a lot of someone's mental capacity that is not really explained well under the neurological benefits. Someone who has anxiety for being in a social situation, cannot handle having a lot of noise or multiple voices around them at the same time. So we pretty much have to go through different categories to be sure. Also, if there is a coexisting problem, like a heart problem, insulin-dependent diabetes, those are things that we also have to take into consideration. And for people that do their applications on their own, the biggest mistake I ever see on them is when they get to the very last section of the application, and it's called the remarks section. And by that point, you're so tired of looking at this application because you've basically put your entire life and entire medical history into an application that you don't even know what else to write. The remarks section, if there is one thing that's important, it's getting that correct. And what we want to do is make sure that every person who has any type of disabling condition, that we mention what their disabling condition is using the same verbiage that Social Security uses. So we would not write in that remarks section, patient cannot walk. Social Security says patient cannot ambulate effectively. Patient does not have upper extremity fine and gross motor skills. And those are the things that when Social Security scans the application, those are the things that stick out. Using the exact term that Social Security uses in their list of disabling conditions definitely helps get this process going much faster. One of the biggest things we see for people who do fill out their own application, they get to the remarks section and they put other things in there. One lady we had put in, well, I finally found my dream job and then I became disabled. Social Security doesn't care about that. Other people put in about what their all their awards, recognitions that they received through their employer. Again, that's not something Social Security cares about. They only want to know that you are so disabled that you do not have the residual functional capacity for any type of significant gainful activity. Another problem that comes up with the Social Security disability is people will say to us, well, I only want partial disability. I want to continue to work. You can't do that during the application period. Because again, Social Security is looking that your condition is so disabling that you cannot work. After you get approved for Social Security and your condition may improve, then you can start work. The amount that you are limited to in earnings without affecting your disability benefits is about $1,300 a month. Anyone who is collecting SSI, especially if someone is collecting it for a child, and that money is going into the child's account, whoever is the representative payee for that Social Security individual has to keep an eye out for the money that goes into the account. It cannot go over $2,000. As soon as it goes over $2,000, someone will get a letter from Social Security saying, you're not eligible, you now have assets in excess of $2,000. And again, that's part of the importance of the ABLE account, because money can go into an ABLE account and will not be considered. And how we help. What we typically do is we will help families, first of all, go through their health insurance policies. We'll read that policy, as unexciting as it is, and we'll look for anything that is in there that raises concerns for us. And of course, those big things that I spoke about were the limitations and the exceptions to the policy. There is other things that we often run into, and it does affect families who have an individual with any type of a brain injury. We've had families that were told that the policy does not cover if you have a traumatic brain injury, only if you've had a stroke. And people have gotten denials for rehab or post-rehab care because of that. By reading the policy and we find out that that is not true, then we have to challenge that denial from the insurance company. And I faced that in more than one occasion, where somebody comes back and says, oh, insurance says they're not going to let me go to outpatient rehab because my condition wasn't caused by a stroke or an anoxic brain injury. And when we go back and look at the policy, there is no exception for that. So that would have to be challenged. The other things that we do are we actually file Social Security disability applications for individuals. We go through the entire process. It takes hours and hours, but I have to say my sister, who does most of them, is very anal about doing it. She makes sure she gets every single thing that's included in medical records and puts it into the application. We want to make Social Security understand what all of your medical problems are. And again, one of the things that comes up typically with brain injuries are friends or family members come up and say, oh, you look just great. You don't need Social Security. But that's not what's internally going on. They don't think about the cognitive impairments, about speech impairments, anything like that. So we have to be sure that we make the person, we make it very clear to Social Security what all of the disabling conditions are. For someone who has a very severe injury and may be in a prolonged unconscious state, we have to make them realize how long it's been. Have they made any improvement? These are the things that we want Social Security to understand about the individual. If it is a case where we do not think that we could be successful in filing a Social Security disability application, we usually tell someone to go to an attorney, because I would rather see someone go elsewhere to get their disability application filed than take a chance of getting it denied and having them wait a year to get a disability appeal hearing. It's just not worth it. So if it's someone whose condition is maybe borderline. Maybe somebody will say, well, you could go into Walmart and be a greeter. Those are the people that will usually give them the name, or will tell them to go to an attorney that only does Social Security disability, just because the appeal process is way too long. We also help with filing the New Jersey temporary disability applications. We will go through the part where the individual needs to fill out, and we're happy to send the other parts onto the doctor and also to the employer. We usually ask them to send us a copy just so we know it gets there. And then we don't have to worry about the temporary disability being held up for any reason. And again, we help with health insurance appeals. We go through all of the processes. It's probably one of my favorite things to do. I love to fight with insurance companies. And I don't want to see anyone get a benefit that they're entitled to be denied. And we'd all know that the insurance company wants to keep as much money as they can, and we want as much of that policy money spent for rehabilitation to get the person well again. So that is pretty much everything we do. The next page is all of our contact information. And anybody is just, you're welcome to give us a call at any time. If it's to ask questions, just kind of pick our brain, tell us what issues you're having. Maybe we can figure out a way to get around it. We do a lot of other work that's kind of expanded out of this whole framework that I've just done. We spend a lot of time working with individuals trying to find subsidized housing, trying to work with them to get food stamps, energy assistance benefits, anything like that, because there are a lot of financial issues that come up for anyone who's going through this. And we want to make sure that we address each one. So even though it's not in my presentation, somebody can always call and talk to us about what they need.
Great. Thank you so much, Cindy, for all of that awesome information. And now I'm just going to go through the questions that we received and read them out to you, and you can provide an answer. So,
okay.
The first question was, this says New Jersey, so is it different for New York? And I think that question came up when you were talking about Medicaid.
Yes. Each state can set their own criteria for Medicaid. Some states do not have the expanded services. State like, if someone goes to Maryland and has an injury, please move to Pennsylvania because you're not getting any services in Maryland. It really varies greatly. Also, not every state has temporary disability. Pennsylvania does not. So that's another thing to take into consideration. Social Security disability is a federal benefit, so that is universal.
Okay, great. Thank you for that. And another question came in asking if what agency does the needs assessment for LTSS eligibility?
They send out a nurse to come and evaluate the individual, and they have a checklist where they go through needs no assist, needs minimum assist, needs moderate assist. And they go through everything from the physical part, getting dressed, preparing meals, eating, remembering to take medications. And it basically comes up with a score. And that score also is something that a lot of times when the service plan is written, will impact how many hours of personal care or private duty nursing someone's entitled to.
Great, thank you. The next question asks if you could explain a little bit more about the workability program.
Yes, New Jersey Workability is a Medicaid program for individuals with a disabling condition. So it could be someone who has made progress after a traumatic brain injury and wants to go to work part-time. This way they could keep their Medicaid benefits but they will, but they will be able to have income that's greater than what the typical level is. They'll also be able to maintain having an IRA or a 401k also. The states vary on what they require for the workability program. In Pennsylvania, you only have to work 1 hour per month, and it can be any type of job. I had one of my brothers on Pennsylvania, we call it MAWD, Medical Assistance for Workers with Disabilities. And my brother was on it for years, and he dog sat for me. So every Saturday he would come over, stay with my dogs, do whatever. And then we were able to get him on the medical assistance program. Because for most people who are on a very limited income, it's basically impossible to pay for an insurance premium, deductibles, and copays. That's why it's so important also to have the Medicaid. And Medicaid covers everything someone would need: dental, vision, personal care, nursing. So it is a great program.
Great, thank you, Cindy. And then next question asks if individuals with spinal cord injuries can be helped with these programs. And I think that question might have come up through just the other New Jersey programs that you mentioned.
Yeah, that's this is not limited just to brain injury, spinal cord injury, burns, amputations. We work with anyone who has any type of a disability, cancer diagnosis. We're not limited to just traumatic brain injury or acquired brain injuries.
Great, thank you. And then somebody else mentioned that it's a lot of information, maybe for somebody with a TBI to really digest. So they were saying, can they, if they need one-on-one assistance, where can they find that? I'm thinking it's through your agency, but if you have any other comments on that.
We will. We'll do anything we can. And it is a lot of information. Even if you don't have a traumatic brain injury, it's a lot of information to digest. We go through it step by step with anybody, understanding that a lot of times someone is so overwhelmed that they really don't get it at first. And doing baby steps and helping someone through all of these applications, we just want to take that pressure off an individual and their family, because it's a very overwhelming experience.
Yeah, great. And then somebody else mentioned a situation that they had and having been denied Social Security twice now. So again, this is something that maybe they could bring to your agency and get help with.
Yeah, and it may be a simple thing where they didn't explain their condition well enough. And one thing that Social Security will do is they will do what they call an independent medical exam. And it's everything but an independent exam, because the doctor who is doing it is hired by Social Security and the results go to Social Security. And again, it's one of those things where someone may walk in for their independent medical exam and the doctor says, "Oh, you're looking so good. Tell me about your problems." And the person doesn't remember all of their problems. So they say, "No, I'm doing great." First of all, we would never let anybody go into that independent medical exam without having a list of all of their disabling conditions to hand to the doctor, because you have a cognitive impairment. You're not going to remember it. And making sure that the doctor also has a complete set of medical records, because we don't want them to make a decision based on only what Social Security has told them, or they've picked up from maybe an outpatient provider. We want them to understand everything that's involved. And when we actually do a Social Security disability application, there is one section that'll say list of impairments. And we always put in there if someone cannot do activities of daily living independently. And activities of daily living, again, is not necessarily dressing or bathing. It could be remembering medications, going to the grocery store. They can't drive, so they can't get to places. So we always list that as one of the disabling conditions.
Got it. Thank you. And then another question came in about having received COVID money throughout the pandemic. They said they received a check and it's been in their account. And I guess they're wondering if that's maybe a problem with the Social Security.
If it comes up, you're allowed to tell, you can tell Social Security that you did receive it as COVID funds. It is not supposed to count against you. However, if Social Security is going in looking at your bank account on a regular basis and they see you're over $2,000, they may not know exactly where that money came from. So we may have to clarify it for Social Security or try to get it out of that account as quickly as possible. Just go in and make a withdrawal at the bank and pay for something that you've wanted, or cover some of your bills that maybe you're behind on.
Great. And then we have, one comment saying thank you so much for everything that you and your sister do. And then just a question about prescription medication coverage for survivors of ABI. So is there any type of financial assistance that an ABI survivor can have to cover prescriptions that they pay for out of pocket?
Yeah, there are a lot of great programs. First of all, if someone is on Medicaid, we should be able to get all of their prescriptions covered. If someone has private health insurance, they generally go by tiers of medication, and there are tiers that the drug itself is very expensive. Therefore, the patient pay is very expensive. But if we can apply for the state low income subsidy for prescription medications. And something I just heard about recently is the gentleman who owns the Dallas Mavericks has come up also with a program where they help pay for medications. Each pharmaceutical company is also supposed to have a patient assistance program. So sometimes it just takes a matter of searching to try to get the cost of those meds down.
Okay, great, thank you. And then another person asked, can you review how to create a qualified income trust for Medicaid eligibility?
Sure, so they call it a Miller Trust in New Jersey. And basically, when you're doing your application and it is flagged because your income is too high, you may get just the straight denial letter saying, I'm sorry, you don't meet the qualifications because your income is X number of dollars and the state limit is this. So what we have to do is appeal that immediately and then contact the state agency that does the qualified income trust and start doing the application to have that excess money sent into the qualified income trust. This is something I didn't review last night, and I apologize. Now in Pennsylvania, we call it a community pooled trust. We can pay someone's rent, utilities, etc. out of that. I think in New Jersey, you can only pay medical bills. But if someone has a particular question about that, I can double check. I haven't reviewed the rules for a qualified income trust for a while in New Jersey. So if they can pay beyond medical bills, like their rent or something, it's definitely something we should look into.
Great. And then another person asked if you could explain a little bit how somebody might go about setting up an ABLE account.
Yeah, it's a simple application. They just go under New Jersey ABLE. They can file it online or download it, or they can call us and we'll download the application and send them a certified envelope to mail it in with. What it is, it's the basic information, the date that you became disabled. They do ask to describe your disabling condition, but you do not necessarily have to meet Social Security guidelines for an ABLE account. The other thing that they will ask is how you want the money. Basically, do you want it invested? Do you want it into a checking type account where you can access the funds if you need it? How, if you're going to invest it, are you willing to take minimal risk, moderate risk? There's a lot of questions about what you want to do with that money. The amount that you could go up to without affecting any benefits is $100,000. Someone can deposit $15,000 a year up to $100,000. That part will not be considered as an asset. If you go over that amount, you could still put the money into the ABLE account, but it may be considered an asset to you. Someone's having that much money, they probably need a special needs trust.
Actually, in the same vein, somebody's asking if if there's any limitations of them trading stocks with an ABLE account. I don't know if you answer.
I don't think you can put it in stocks. I only think that you can put it into an investment account, and the state basically does the investments, or just put it into a regular savings account where you can access the funds. I'm not aware of any stock options for ABLE accounts, and I don't know if that would even be a wise move.
Okay, got it. Another question here about, do you know if there are any programs available for cognitive assistance for acquired brain injury?
Yeah, if someone is covered on your Medicaid, the acquired injury is not handled any differently, or health insurance, it should not be handled any differently. Whether there really isn't, I don't believe, instead of a traumatic brain injury fund, I do not believe New Jersey has anything that identifies acquired brain injury fund. But any of the programs that someone needs, we should be able, if we can't get it through the state Medicaid program or through their private insurance, we should be able to get it through the managed long-term services and supports. And managed long-term services and supports in New Jersey covers some of the expanded services for brain injury, like a Bancroft, a neurorestorative, where they have day programs, semi-independent living. So those are covered services under New Jersey's program.
Great. And then if somebody would like to set up an appointment to go over everything with your agency, what would be the process for that? Would they call? Would they?
Yeah, they just call, and we'll set up a time where, if we're not busy at that particular moment, we could do it right then. But if they have a lot of things that they want to go over and they want to set up a particular time, that's fine. If someone wants me to meet with them, I'm happy to do so. Sometimes just that one-on-one explaining things helps people. So whatever we could do, our purpose is to be out there for you. Just let us know.
Thank you. And then somebody's asking if you know what the major difference is between New Jersey and New York Medicaid, because this person is mentioning that they want to take their daughter, who's a New Jersey resident, to their home in New York.
New York has been making some significant changes in their Medicaid system, especially where it comes to personal care services. They are getting a lot like Maryland, which is being very stingy with them. So I guess it's dependent upon what the individual's needs are. If they need private duty nursing along with personal care, I would want to look into that very carefully. The other issue with if someone needs private duty nursing is what is the availability of nurses in that area. Where every state is running into problems of nursing shortages, and in some states it's much more pronounced. And New York is one of the states that the nursing shortage is very severe. Mm-hmm. So you could get approved for the time, you could get 20 hours or 30 hours of private duty nursing approved under a Medicaid plan, but you may not be able to staff them. And that's sad. But it's just a reality of what's going on right now.
Yeah. Okay, great. And then this question asks, have you ever worked with DVRS to assist with getting into a workshop like WOC or CVR?
We don't typically do that. It's not really my area of expertise. So I kind of leave it to the people through the different rehab agencies and the vocational rehab.
Okay, great. Then someone's asking about the fees for, I believe, your services.
Absolutely none.
Yep.
No matter what we do, we will not charge anybody anything. If we have to send things overnight mail, certified mail, we do not ask for the postage. We charge absolutely nothing for anything that we do. And we don't solicit donations either. So they don't have to worry about that. We won't be like the politicians that are sending me 20 text messages a day asking for donations.
That's fantastic. All right, great. And then another person's asking about vocational programs or peer groups or support groups for someone with a TBI. If you have any ideas.
A lot of them have gone virtual. I used to attend the one at the hospital of the University of Pennsylvania, Penn Presbyterian, regularly. They went virtual for a couple of years. Last month, they tried to go back to in-person. I don't know if there was a problem because now they're going back virtual. I know St. Lawrence Rehab has one. Kessler, through their Chester office, I think, has a support group meeting. And I think BACREC does also.
Great, and I'll add on to that too, actually, through our agency, the Brain Injury Alliance, there's support groups available all over the state. So if you go to our website, you'll be able to click on the county that you're looking for and find support groups that are meeting there as well.
Yeah.
All right, great. Somebody's asking about how to establish a special needs trust.
You have to go through, it requires an attorney, and you also would need most likely a corporate trustee like a Merrill Lynch, Morgan Stanley, somebody like that. They have a lot of rules on the special needs trust, especially age rules. I think if you're over 65, you can't set one up, but there are several rules on it. We know a few people through Merrill Lynch and Morgan Stanley that do them. We get a lot of requests, for information. But once we refer it to where they should be going, it kind of is out of our hands at that point.
Okay, great. And then one last question. Do you assist with DDD applications?
We do, yes. They're a little complicated and it's not the easiest department in New Jersey to work with, but we will be happy to assist somebody with those.
Great. And then somebody asked here about your contact information in the agency. So that's on the screen right now, the contact information, her email and her phone number. And then I can go back to the beginning. Actually, no, yeah, I'll go back to the beginning. You could see her name is Cindy Clark at the Tri-State Advocacy Project. So that's how you can find her. And I'll put some information in the chat as well for you to be able to write that down. And then somebody's asking if we could get them a copy of the PowerPoint after the presentation. If you're okay.
Yeah, I can. If somebody sends me an email, I'll just email it over to them.
Okay, very good. We might be able to also send that out with the recording as well, as long as you're okay with that.
I'm fine. Yep.
Okay, great. Does anybody have any last questions then before we wrap up? I think I answered everything in the Q&A, so I just want to make sure I got everything. And I'll mention as well in the chat, there is the link to the post-webinar survey. So if you could fill that out, that would be helpful for us just to see how helpful it was for you today. And so we can take your feedback. So please fill that out. And I will put Cindy's information in the chat again. And then I had one more question come in, Cindy, if you don't mind. Do you assist with Social Security appeals?
No, we don't. We leave those up to the attorneys. If we're not able to be successful the first time around, I usually tell people to get an attorney because they're going to be up against a judge through the Social Security office. And you don't want to go there without having the backing of an attorney to help you through that.
Okay, great. Putting your information. Oops. That's not it. Okay, I think that's all the questions that we have. So thank you so much, Cindy, for all this incredible information. We appreciate your
Oh,
time.
anytime, please, just tell anyone, call us if you have a question. And the earliest we can start working with a family, the better off we are. Because that way, any red flags, any problems, we can anticipate in advance and make arrangements to be sure that we have those addressed and we recognize the problem of what it is.
Wonderful. All right, well, thank you so much. And thank you everybody for
Thanks.
joining. And please complete the survey. And if you have any questions, feel free to reach out to us and we will get you connected with Cindy. And this concludes today's webinar. Thanks so much, everyone.